In India, around 1 in 68 children has autism. Many parents worry and feel confused in the beginning. But every child has a beautiful mind and a unique way to grow and learn. Today, we will understand how to support our children with love, patience, and the right guidance. Let's begin the highlights of our regular webinar.
Professionals' actual center of attention, attention is towards improving the behaviors, or towards improving the child in comparison with other kids. He is not sitting in the class, so he should sit in the class, or he's showing some behaviors, stereotypical behaviors, so he should stop the stereotypical behaviors. And major time, lots of time goes in that managing the behaviors. Important age, child was diagnosed at the age of 2.5 years, 2.5 साल में उसका डायग्नोसिस हुआ है और अभी वो 7-8 साल का हुआ है, and still the parents and the professional is working on managing the behaviors. Okay, where the development has not gone up. Okay, only things are going down, so some things are popping up. वो जो पॉपअप हुआ उसको ठीक करने के पीछे पड़े तो और कुछ नया बिहेवियर आया. Parents are keep working on saying autism is not treatable. So that is all about maintenance approach. I have discussed in my previous webinar. You can go through those. It's on YouTube, so you can go through it. Maintenance approach is all about cosmetic approach. It's all about symptomatic approach, in which, in like malaria, what we see is a person is showing symptoms of fever with chills. तो अगर कोई वो सिर्फ फीवर को ट्रीट करने की कोशिश करे 10-12 दिन, तो शायद 12वें दिन वो इंसान क्या होगा. अगर सिर्फ फीवर को अगर हमने ट्रीट किया तो व्हाट विल हैपन, कैन यू प्लीज पुट इन द चैट बॉक्स. सपोज इफ यू ट्राई टू ट्रीट, सिर्फ उसको पैरासिटामोल दे दिया उसके फीवर को ट्रीट करने के लिए, या सर दुख रहा है उसका तो उसको हेडेक की कुछ दवाई दी, तो व्हाट विल हैपन आफ्टर 12 to 15 days. कैन यू प्लीज पुट इन द चैट बॉक्स. Or can say, we can save the time. I will ask you, Arshali, what will happen? You are from a doctor family. So suppose अगर मलेरिया को सिर्फ फीवर को और सिर्फ हेडेक जो हो रहा है, ओके, सिर्फ उसकी दवाई दी तो क्या होगा? What will happen?
फीवर तो जाएगा नहीं, बिकॉज इन्फेक्शन जो मेन है वो तो रहेगा ही बॉडी में.
Exactly. सो फीवर जाएगा नहीं, शायद जाएगा, नहीं जाएगा ये मैटर नहीं करेगा, लेकिन वो 12वें दिन के बाद वो जो पर्सन है वो आईसीयू में डेफिनेटली रहेगा. बिकॉज मलेरिया इज नॉट फीवर, इज नॉट हेड. मलेरिया इज ऑल अबाउट इन्फेक्शन इनसाइड द बॉडी, एंड बॉडी इज रिएक्टिंग टू इट. बॉडी का एक खुद का एक प्रोटेक्टिव मैकेनिज्म है जिसमें से वो दिखा रहा है बॉडी लोगों को बाहर कि इट इज फीवर या हेडेक हो रहा है. तो सिम्टम इज नॉट डायग्नोसिस. तो मोस्ट ऑफ द पीपल जो डायग्नोस सिम्टम्स को ही डायग्नोसिस बोलते हैं, वो लाइफ टाइम मेंटेनेंस अप्रोच में रहते हैं. एंड देन इंपॉर्टेंट वेरी प्रेशियस टाइम ऑफ अर्ली इंटरवेंशन और मिडिल एज गोज इन बिहेवियर मैनेजमेंट. ट्रेनिंग अप्रोच इज ऑल अबाउट child is not doing this, so I will use various noble approaches to train him to write, to read, or to sit, or to speak, or to behave, or social skills. I will train him. Say hi, say bye. Whether the child wants to say hi or say bye, that doesn't matter. Lots of training approach without understanding whether the child's inner drive is there or not, without understanding whether the child has developed adequate social interaction ability or not, or without understanding whether the child has developed that receptive intention, receptive communication or not. Most of the professionals and parents will keep training the child. In that train, child's inner ability is not there, inner learning ability is not there. So then bombardment of things keeps happening, and there are few parents who feel कि बच्चे को बहुत ज़्यादा parents professionals. It's not about parents and professionals. I have already asked everyone to go out of this field and let's look at what is happening in autism and treatment, and with all of us, what is happening in this field and how this field is actually going ahead. सो फ्यू पेरेंट्स फील कि बच्चे को जितना ज्यादा हम लोग एंगेज रखेंगे उतना ज्यादा बच्चे अलग अलग स्किल सीखेगा, लेकिन अगर लर्निंग एबिलिटी टिपिकल बच्चे से अगर 20% कम है, 40, 50, 70, 80% कम है, तो उस लिमिटेड लर्निंग एबिलिटी में हम कैसे बहुत सारी एक्टिविटीज उसके ऊपर बम्बार्ड करेंगे। और बहुत सारी एक्टिविटीज वो ऐसी हैं जिसमें शायद डेवलपमेंट में वो बच्चे को शायद उसका उपयोग या उसका यूज नहीं होने वाला है। सो दिस ट्रेनिंग अप्रोच इज पेरेंट्स बहुत ज्यादा ट्रेनिंग में जाते हैं एंड देन बहुत सारा टाइम, बहुत सारा इंपॉर्टेंट चाइल्ड एंड पेरेंट कनेक्शन उसमें लूज होता है, बिकॉज चाइल्ड इज नॉट रेडी फॉर दैट ट्रेनिंग। चाइल्ड डोंट नो कि व्हाई आई शुड डू इट। अगर मैं ये क्यों करूं, अगर ये मुझे पता है तो मैं वो इनर ड्राइव से करूंगा, लेकिन क्यों करूं ये पता ही नहीं है, उसका ओरिएंटेशन नहीं, तो मैं चाइल्ड बिकम्स अ ट्रेन्ड और थोड़ा सा रोबोटिक ट्रीटमेंट, रोबोटिक डेवलपमेंट होती है, और उसी को हम लोग कहते हैं कि हाँ ऑटिज्म में बच्चे की डेवलपमेंट ऐसी हुई। Let us understand what is the developmental approach. I have explained in the first webinar, okay, and it's there. I have explained it developmental approach in number of webinars I have taken in COVID and later on, so you can go through it. If any queries you have my number. You can ask us. You can definitely talk to us, because I believe after a certain age, I don't want to work on kids, but I want to work on the society. I want to work on the mindset where the society is going towards. Okay, so that's about the recap. लेकिन recap में शायद 25 minutes हो गए to express what is developmental approach. Developmental approach is all about there is a brain. I don't want to go in the brain, but again 2 hours will happen. These lectures are there. In the brain there are different areas are there. The highest area what we human have is a cerebral cortex, in which a lot of higher functions are areas are there, and to enumerate them, it's memory. Memory is not memorizing. It is all about under keeping the incidences or storing those incidences, good and bad, in the way they are in our subconscious mind. That I call as a memory. It's not memorization. So memory area is there where we get a lot of information from our past, and then we try to work on our higher functions like communication. Like first I will say orientation, like with place, person, object, situation, around, about self, about others. That is orientation. Then is the thought process, is the thinking. What thoughts I create in my mind when I'm getting oriented. I see a mango, what thoughts comes into my mind. I see my mama, what thoughts comes in my mind. Then thoughts, then imagination, it's emotions, decision making, problem solving, analytical thinking, creative thinking, reasoning, logical thinking. These are all the higher function areas because of which we are different mammals. We are different human. Human is different than other animals because of the cerebral cortex. These areas are in every human being. These areas are there, but due to certain reasons, these areas do not receive adequate information to develop, and this adequate information is very much same for a normally typically developing child also, and very much same for autism or a severe autism or any kind of a developmental disability also. It cannot be different. Like autism, child's developmental approach is different, and normal child's treatment is different. Only there are 2 types of train. One is a fast train and second is a slow train. But we have to be on a track that I discussed in the first webinar. So when we say the higher cortical functions, more they develop, more the child is going to be independent, more the child is going to develop the social skills, more the child is going to be a part of society. First be a part of family, then be a part of society. And more the child is going to be independent. So that's about developmental approach. One of the parent asked me, can you please share the case studies you have in last webinar. So I thought let me express these case studies to you. So I would like to express few case studies where how we understood, how we analyzed the child in a different stages of development, and how we created development in him by helping parent and child come together and be a efficient part of the family and society first. So allow me to share the screen. This is our CRM. Let me go to my one of those sectors.
Yes, we can see.
Uh, okay, I'll explain it from the online therapy services what we are already taking. Somebody asked me about online therapy services, so let me take you to Bhavish. There are few case studies I have found. There are all of them are like that, but few case studies for so that the parents can understand better. Now, Bhavesh is a 21 year 5 months old child. Okay. Now we call it the adult autism. The parents had come from Delhi. Somebody asked me, can we take this case from can you take us from anywhere? So I we can. This child came from Delhi. Uh, in fact, parent came first to us after listening to our webinars before. They came to Mumbai, and their concern was very much different, very much different, means very serious also. Both the parents came from the flight, met me, and went by night flight back to Delhi. The child's complaints were his self-directed and demanding behaviors, no problem. Aggressive behaviors, okay. Few kids have, but his aggressive behaviors like he doesn't want to follow, okay, exercises. His problem was binge eating, okay. Gets violent and may bite brutally if very basic demands are not fulfilled. बिंज ईटिंग इज ऑल अबाउट उसको बहुत ज्यादा खाना खाना था, और अगर कोई भी खाना बनाया होगा तो पहले वो खा लेता था, और खाने के बाद जो भी रह जाता है, शायद वो रहता भी नहीं था, लेकिन जो रह जाता है वो फेंक देता था कचरे के अंदर. तो पेरेंट्स एक्चुअली स्टार्विंग, यू नो, पेरेंट्स को एक्चुअली छुपा कर वो सोने के बाद उसको खाना मंगवाना पड़ता था और वो खुद खाते थे. दिस वाज द कंडीशन एट होम. One more thing, disclaimer, this don't get emotionally connected with the case parents, because I have seen parents quickly feel कि मेरा बच्चा ऐसा होगा. No, this is just a case presentation. Come out of your autism family and let's understand what is it. Okay. So binge eating keep repeating demands and wants parents to repeat behind him. तो वो क्या करता था? Demand करता था. He used to create a demand and then I'll just make it big. Okay. He used to create a demand and then he used to say कि parents ने वही demands को repeat करें and उसको follow करें. Now, when I saw this, I could exactly see the mirror of the parents who were doing this with him before. For a few years back, I had this question to parents. Getting sexually aroused, that's not a problem. That is not a problem. At 21 years, child getting sexually aroused is not a problem. Okay, for me, in a developmental approach, because he is a human being. Poor play and leisure time activity involvement, wants to go to toilet and enjoy jet pressure. ये बहुत सारे typical behaviors हैं. Made everything that nothing left behind. May hit car windows, getting aggressive at crowded places. Okay, तो यहाँ पर कुछ चीजें हैं जो आई कॉन्टेक्ट तो था, बहुत सारी चीजें डेवलप थी, लेकिन वो डेवलप निगेटिव बिहेवियर्स के लिए थी. उसका हायर फंक्शंस अगर हम लोग देखेंगे तो वो 3 से 4 से 5 साल के बच्चे की तरह था. हायर फंक्शन में कहूंगा ओरिएंटेशन, थिंकिंग, इमेजिनेशन, वो सारी चीजें. बट ही हैड सम बिहेवियर्स. प्ले डायनामिक्स कुछ भी नहीं थे. ही डिडंट वांट टू मीट एनीवन. अगर एंजाइटी हो गई तो लिसनिंग म्यूजिक, अगर लिसनिंग म्यूजिक तो सो जाएगा, और नहीं तो फिर से द साइकिल वाज गोइंग ऑन. Behaviors point of view, severe ODD. ODD is a oppositional defined disorder, जिसमें child says everything no to if somebody is asking him. Okay. Severe self-directed and aggressive behaviors, binge eating, does not leave food for others. Severe superego. Superego is all about I will no rules following, no rules, no social skills, nothing. And there are many behaviors were there. On observations, we saw there are some certain SI observations there, and based on this we did certain tests. In which certain tests we do unofficially, like VSMS is supposed to be should be done till 15 years, but when we did it, its social age come to 5 years and 4 months. typically developing child may, so VSMS cannot be done beyond 15 years, but in autism child, when we do it, because we don't want to diagnose the child, we just want to understand the child's developmental stage, उसका social age था वो, and then impulsivity was very high, hyperactivity was very high. Same thing with the therapist scores. And Gillian Autism Rating Scale is a wonderful scale that we follow to understand autism, not to diagnose autism, to understand autism in the child. That stereotypical behavior, communication, and social interaction, that all three things are from the parent's point of view very likely, and has to be very likely because he was showing lot many different social interaction, communication dysfunctions, and certain unusual behaviors. Therapist score was also very likely, where communication was coming in a very likely stage, and social interaction he was showing a lot of self-directed behaviors. So based on that, we started with the treatment with the developmental approach, and where we saw that there was there were a lot of many behaviors, which were coming because of parent-child transactions. पेरेंट और चाइल्ड के इतने सारे सालों का ट्रांजैक्शन जिसमें पेरेंट्स ने थोड़ा सा पुश किया था, जिसकी वजह से बहुत सारे बिहेवियर्स आए थे. We didn't want to say the child is showing behavior. Most of the time, let me tell you, behavior is not a bad word. Behavior is a normal word. Behavior is anything, is my reaction. My reaction is a behavior. Okay. So, reaction to what? Whether my needs are fulfilled or not fulfilled, and how my needs are fulfilled. Based on that, I will create a response. That response is called as a behavior in psychology. Behavior is not a bad word. So his behaviors is because certain responses he has created due to what we saw in the online sessions when the parents and child was transacting with each other. There we saw the child and parents were operating from a lot of training approach, and not many behaviors were given importance to control over there, even though he was a 21 years old. So in that, when we started working, almost after 2 months, almost after 20-25 sessions, we didn't have to work on a child first, we had to work on a parent first to make them understand what is a developmental approach. And हमें ये improvements मिलते हैं कि reduced aggression rates, frequency and intensity was reduced, improved parental understanding. First of all, it's very important, अगर आप कोई भी इंसान आपके सामने बिहेवियर दिखाता है, तो सबसे पहली चीज है ये देखना कि how much I am connected with that person, how much the child is connected with me. If there is no connection, then definitely negations will increase. So we saw that parent-child bonding was not that great. Parents now still they were thinking how I can improve his behaviors. Developing parent-child bonding, that he started giving social smile, he started giving he started showing basic interactions, which I call an improvement, not development. Based on that, we set certain goals. Now these goals are very important. I wanted to show you. The goals are like, so we accomplished 18 online sessions till date. Parents are trying to follow parenting approach as per his functional level. So we keep certain goals, and this is very important to understand what is the developmental approach. Okay, I did not write over here that Bhavesh will stop playing with the jet spray and stimulating his private parts. I did not write Bhavesh will sit at one place and he will start writing or something, or Bhavesh will stop his certain behaviors. My goal was Bhavesh will show interest in parents' day-to-day functions. Need-based or non-need-based, parents will document 8 to different experiences that Bhavesh has started showing interest in them. Why? Because based on what parents have started showing interest in him. It's a give and take all the time in a developmental approach. Then Bhavesh will start helping mommy in cooking food. Since it was a food related, mommy used to cook the food, he used to eat and he used to throw, and making and seeing the expressions on mother's face. So somewhere I saw that food is something is fixation. So what we can create is, let him create the food, let him make the food, and how mommy can, he and mommy can get along with each other based on his fixations. So based on that, getting raw food from the market, parents will document around 10 to 15, only 10 to 15 experiences in the next 2 months I wanted. I didn't want a lot of change in all, because everything starts from a little bit, and we have to identify the elements of development in that little bit moments. Certain things were there that he will start making food by himself. To cut the story short, he'll make his own bed. So we wanted him to be independent. It was not so simple. This case was not so simple, and I would like to take one very, very important person's name. The therapist who treated him was Dr. Somil. Dr. Somil Ashar is an amazing, amazing adult autism specialist CRC has, along with other therapists. That he put his soul into that to make parents understand कि it's don't look at autism, don't look at behaviors. It's about your child, and your child wants only two things. One is a joy, and second is exploration, which I explained in the day one webinar. Child wants, or any person wants, two things: exploration, and second is a joyful moments or happy moments. सिर्फ इन्हीं दोनों से लर्निंग पॉसिबल है, बाकी अगर ये दोनों नहीं है तो ट्रेनिंग ही ट्रेनिंग है ऑटिज्म चाइल्ड की लाइफ में. So let's move towards second review. Second review happens after, let us say, now Bhavish is 22 years. After few 2 to 3 months, parents are trying to follow, understand his I call it as a mammalian brain approach versus reptilian brain approach, because he was showing a lot of aggressions. So based on that, improvements were that he has the name is changed, had begun assisting mother in cooking. It's supposed to be Bhavish, involving parents function day to day, need based and not need based. Parents had done few documentations, had made 1 or 2 STEM activities under parental supervision with respect to making food or helping them in day to day activities. Began bed making in I do UC approach. I call it as a I do UC approach. Is let me tell you one thing. There are two different approaches. Training approach is different. Learning approach is different. When you want to learn something from someone, you don't follow what somebody is telling. You get inspired by somebody is doing. And especially children, they get inspired by somebody is doing. They don't follow what somebody is saying. And if the child is following somebody is saying, then it is a training approach. So he started following mother with I do UC approach, had initiated following various day-to-day commands, but reduced at present. But बहुत सारी चीजें थी यहाँ पर. मुझे बहुत ज्यादा डेवलपमेंट का धमाका नहीं मिला था, लेकिन मुझे एक चीज सबसे इंपॉर्टेंट मिली थी, that the parent had understood, okay, how to deal with him and how to make him behave like a dead son and not like autism child. फंक्शनल इन्वॉल्वमेंट हो गई थी, लेकिन थोड़ी देर के बाद रिग्रेस हो गई थी. शोज मल्टीपल इंस्टेंस ऑफ पॉजिटिव इंटरैक्शन एंड बिलोंगिंगनेस इन द फैमिली. इम्प्रूव्ड सेल्फ इनिशिएटिव, सर्विंग वाटर टू पापा आफ्टर कमिंग फ्रॉम ऑफिस. ये बहुत इंपॉर्टेंट था क्योंकि he never had this kind of an interaction with father. The papa अगर ऑफिस से आते हैं तो he started showing that belongingness to father, and every father wants this from their son. And this saw after many years in their son. He was doing it before when he was 4, 5, 6 years, but over the period he has lost the interaction and he has lost interest in parents, because parents were always pushing him to train something or to improve something, and nobody wants to see. किसी को भी पसंद नहीं है कि कोई मुझे बोल रहा है हर वक्त कि आप इसमें improve हो जाओ, आप इसमें ये करो. Nobody likes that, and definitely because of that, many autism kids gets diverted to show negative behaviors, and I don't call it as autism. I call it as an affected transaction between parent and child. Based on that, we keep certain goals. Bhavesh will become compliant in certain areas, which Dr. Somil explained them later on. He will stop negative behaviors with parents with adequate fuel towards parents' ruthless behavior. Now, somewhere I had to create, once the connection was developed, I had to create some kind of authority in the parents only for negative behaviors, but not the autism traits over there. Because I am a human being and I have all the right to save myself, to protect myself, and where parents under the name of love and all becoming the victim of his negative behaviors. So there we had to create some kind of a parenting approach we had to give, where Bhavesh will understand that he stays in their house and not they stays in his house. So somewhere behavioral approach was discussed. यहाँ पर एक important चीज था, भावेश will develop enough fear of separation. Enough fear of separation is all about I cannot live alone. I cannot live without my parents. And this is a basic ideology behind any love and we can say respect. I believe this because unless and until I don't fear that I will lose that person, I will not give respect to that person. So that's more important, that he will develop adequate fear of separation, that I want mama around, I want papa around. Previously what was happening, I just want to be alone in my own world, let papa and mama before me. And a lot of time went in this case, but over the period, we saw around, let's say, fourth review, we saw Bhavish uh, started showing improvements and reducing the things, that started talks, transactions, cooks basic food with minimal assistance for others, but may or may not share, serve them. He had at least started making a food, लेकिन वो serve नहीं कर रहा था उस वक्त. स्टार्टेड मेकिंग पॉपकॉर्न, लेमन वाटर, शरबत स्कूल. ये यहाँ पर दिखाने की ना, बोलने की ना, क्या इसमें क्या बड़ी बात है कि लेमन जूस बनाना, मेरा बेटा भी बना था. बट एट द एज ऑफ 21 years, where he had developed lot of negativity in his this things. This is possible with the developmental approach, in which parent and child connection, parent child bonding is more important. And parents are getting involved in their leisure time, but the regularity and frequency. I also ask, parents should live their own life. In developmental approach is all about parents should not become an autism parent. He has his own life, she has his own life, she has left. Sir, I have left my job. I am not doing anything in my life because I just want to have my child. And अभी वही मेरी दुनिया है. ये जो parents बोलते हैं ना, इनके बच्चे कभी भी डेवलप नहीं होते. ये मैं बहुत ही समझ कर बोल रहा हूँ. लेकिन जो पेरेंट्स बोलते कि मेरी लाइफ है, ओके, चाइल्ड इज जस्ट 5% इन माय लाइफ, ओके, ही हैज हिज ओन लाइफ, I have my own life, I will not change for him, okay, but I have developed a culture, I am experienced, I am living in the way, the child is supposed to follow my culture. For that I will do everything so that he will be a part of my culture. I will give him love, I will give him everything. People who try to move towards autism and try to behave in autism manner, autism is a very difficult disorder to treat then. So it's not, in the developmental approach, it's not about becoming an autism parent, but become a parent of a developmental delay child. Okay, my child is 8 years old, okay, my child is 21 years old, but he is behaving like a 5-year-old child. Let me transact him with a 5-year-old child. Developmental approach where it's not about finding autism and treating autism in the child, it's about finding child in the autism and developing that child.